Hi, Dr. Rob Norris, pharmacist here at Chambers Apothecary. Hope you're having a great Monday. I know lots going on in our communities right now, and so I'd love to just get into some stuff here, specifically on the coronavirus. And I'm sure you've heard this from about a million different sources, but I think it's our obligation as a pharmacist in your community and as a leader in the healthcare to at least put out facts that we have in our hands. Our sources that I'm going to be reading from here is compiled from the NIH, the National Institute of Health, the WHO, the World Health Organization, and the CDC. And so this is pretty good sources based on what they're putting out in regards to this. I think most people have seen on Facebook, have seen information on Instagram or other social media outlets. I think of that, probably another 80% of that is based on opinion. I have seen some good facts out there, but I see a lot of opinions and a lot of facts that are off the mark. And so I at least wanted to do our part to at least just go over some basics here with you and just talk to you a little bit about what we're doing at Chambers to ensure a reduced potential exposure for our patients and us as our healthcare providers. If we look to the other two countries, specifically Italy, if this does become more prevalent into our local areas, pharmacies are staying open. And so that is me and my staff are committed to our community to be here. We're stocking up. We want to assure you we're doing everything we can to be ahead of the curve based on the information that we have at hand. And so part of that is taking this seriously and doing our part to get the community to take it seriously because we want to be healthy. We want you to be healthy so that if in fact this does hit us more locally, as healthcare providers, we're able to do our job and serve you and to get you healthier. But then also so that we're keeping our elderly safe and our people of our community as safe as possible. Moving forward here real quick, and I'm sure, again, you've heard this 1,000 times, but let me say it from our perspective. The novel COVID-19 or the coronavirus, novel meaning this is a new virus. We haven't seen it before. It is a virus. This isn't necessarily, and I see it compared to a lot from the influenza. This isn't influenza. This is its own virus. And it's specifically showing symptoms of fever, which is in greater than 80% of the patients, cough, which is seen in greater than 80%. Shortness of breath is around 30%, and muscle aches and pains is around 11%. So those four symptoms are really the more prevalent versions, really the cough and the shortness of breath along with fever with or without. It's kind of what are the markers for this. It doesn't help that during this time it's also regular seasonal flu season with influenza. It's regular cough and cold season. So a lot of these symptoms can mimic. And ultimately, my biggest piece of advice is use common sense, be smart. Don't underestimate any of this because even the flu, a lot of people are kind of downplaying this because, the flu is a big deal. Well, the flu still kills thousands of people. We should be concerned about that. And as a pharmacist, we talk about vaccinations for flu. So please listen to the healthcare experts when we say prevention for coronavirus. We don't want to be thousands of deaths. And even if it is comparable, do we still want that on our hands if we can be smart and knowingly do measures to prevent against that? So that's what some of this facts is. And ultimately, if you're unsure, contact your local hospitals, testing sites. I know a lot of this is fluid at the moment. Thankfully, from what I understand, there is not a confirmed case, at least as of this moment, in our county. I know outside our counties there are. We'll see what happens. We're looking at this from day by day. But those are the main symptoms. So if you exhibit any of those, if you've been around anybody in the last 10 to 14 days, you need to be cautious. There is a pretty lengthy asymptomatic period where you don't necessarily have to show signs of any of this and you could be carrying it. Again, we haven't had confirmed cases in Chambersburg, in our counties, but that doesn't necessarily mean that it's not here necessarily. There are still a lot of logistics that are getting worked out. I feel like our healthcare providers and our local municipalities, everyone is really being on board and spearheading, at least from the conversations I've had with our local leaders. So I feel confident there. So moving along, Prevention, you've heard this in a lot of different places. Frequently wash your hands. Do that for at least 20 seconds. Do that as many times as you can in a day. Obviously, do it if you're noticeably making contact with someone, that could be sick. We shouldn't be potentially contacting or making contact with anybody anyways. If you think you're sick yourself, cough into or sneeze into your arm, to your shoulder. It's funny though that I also see that kind of the new trend, instead of giving a fist bump, they're saying give an elbow bump. Let's be smart here, people. If we're saying cough in our elbow, don't elbow bump. Right now we don't think that this virus can transmit from inanimate objects. So chances are we're not transmitting it, but why? In my opinion, this is all an odds and percent. So why increase percent? Let's just not contact. Let's cough into our elbows and sneeze into our elbows. Don't give an elbow bump. Let's just be smart here. When you can't wash your hands with soap and water, make sure you have some hand sanitizer. There's some mixed thoughts and processes on that, but I do believe if you have a good hand sanitizer with an alcohol content of more than 70% based on different regulations or sources we've heard, some higher, some lower. I think 70% or higher is a good cautious way to be. If you can't, anytime you would want to use a hand sanitizer, go wash your hands. That's the best piece of advice. If you can't go wash your hands, then I would say use your hand sanitizer as a secondary measure, but definitely not a first or primary measure. I think the idea behind hand sanitizer and a lot of products that people are thinking of buying right now is really addressing more of a self-comfort perspective, and the idea that they think they have control in a situation where a lot of us have no control right now. And so I don't want our patients and people to get caught up in, listening to the social media end of things and getting some bad information just to try to fill a void of being healthier when in theory it may not even give benefit. Alcohol also knows to dry out the hands and crack the hands. So if you're using that in combination with washing your hands, use a moisturizer. We need to make sure you're not drying your hands and cracking them and causing more potential reasons that you can actually get infections. There's thoughts process on masks. There's information that suggests that if you're the actual person who's sick, that mask, if used properly, keyword there, if used properly, can decrease transmission. I've also read studies that show that people nowadays who use masks don't use them properly, and so as a whole, they're finding the whole mask to the general public is kind of ineffective, and it's because people don't really understand how to wear the mask, how to use them. They get over comfortable with them. They're not disposing of them or taking them off correctly, and in some instance they're creating situations that are worse. So common sense here, social distancing. I would definitely recommend listening to what our healthcare experts are saying, and knowing that if we can prevent it from getting spread around and worse, and if you look to countries like China and Italy, where it is oversaturating our resources. That's my most concern. We know this is targeting the elderly people. We know some of the facts that's being put out there by our health experts. But the bigger thing, the message that I think people need to understand is you got to take this seriously, and not attending functions or public events with the chance of spreading it. Right now it's not in our county, but chances are it's coming if it's not already here. And we'll see. I don't think that's raised, cause for an alarm, but I do think that we need to be smart. My only fear would be that we don't listen. Hindsight's 2020. More people are getting sick, and what we're seeing in some instances, even in the United States, in some cases, definitely in Italy, where they're having to healthcare providers are having to choose based on having limited resources of who gets treatment, who doesn't. And I think that's our biggest takeaway message is let's do our part individually. Get educated. Please don't cite Facebook and Instagram as your sources of information. Here you are listening to me, but I am, hopefully you're local to us. That we're a reputable pharmacy and business in our area. Listen to your health experts. Do not listen to people's opinions. There is so much information out there on any topic, and you can literally find studies at any which side of the coin you are on. And so I think it's very key in today's society on any subject, but specifically this, make sure you're getting good, accurate information. I've heard the conspiracy theorists, I've heard it all. And so what we can do as a healthcare provider is give you fact and help you understand to listen to some of the common sense and smarts that need to be done. With that, we would love to answer any questions that you might have, specifically regarding to uncertainty of what could work, what doesn't work. We're, like I said, we're committed to trying to be as ahead of the curve as we can here. We're ordering extra medications as best as we can. We recommend 90-day supplies if your copay allows, if your plan allows. We're helping to try to get through that. Limit exposure. If you come into our pharmacy, we're going to recommend, hey, we have a drive-through, we have curbside assistance, we have free delivery. Utilize those even if you're not sick. If you are sick, definitely we recommend please use those resources to you. We will get any over-the-counter product you need. We will be as fast as possible that we can take care of you safely. We really just want to limit the exposure to any other potential patients, and even us as the staff, so that we can be healthy and maintain to be open if for something unforeseeable would get worse in our county. And so wrapping up here, there's a lot of information out there. I at least wanted to start the dialogue here representing Chambers Apothecary. We are doing a lot of precautionary measures in store. We're doing hourly cleanings. We are going overly cautious to ensure that when you come into our store, your environment's clean to the best of our abilities, based on the latest information being put out by good sources. But we ask you, hey, send us a question, a comment below, send us an email, give us a call. We'd love to know what questions, where are your concerns, what uncertainties are you having. And if we have access to the correct information, we will get those answers for you. And remember, here at Chambers Apothecary, we're looking out for you, our patients. We are looking out for our community. We want to be a trusted resource, and we hope you have a great rest of the week, and stay tuned for more information as we hear it. Thank you very much.